A health official in Ontario has confirmed that a child has died from rabies after contact with a bat in the Brantford area. The child reportedly woke up with a bat in their room, but the parents did not see any signs of a bite, scratches, or saliva, and they did not seek a rabies vaccine. This is the first domestically acquired case of human rabies in Ontario since 1967 and the first ever involving a Brantford-Brant resident. Let's bring in Canada Tonight medical contributor Dr. Samir Gupta for more on this. So, Dr. Gupta, thanks for being with us. You know, as I said, human cases of domestically acquired rabies, extremely rare. Let's talk about how unusual this case is.
Yeah, I mean, it's really sad, Travis, and you're right, it's rare. If you look back, you know, in the last 100 years, there have been 28 cases of rabies in this country, and some of those were actually not domestic. Some of those were the exposure occurred in another country, and they returned here and developed the rabies. So this is very rare. Around the world, it's not that rare. You know, 60,000 people, believe it or not, still die every year of rabies. That's usually canine rabies. It's in less developed countries where they don't have programs like we do to detect and eradicate rabies in dogs. Whereas in this part of the world, it's usually bats. Rabies is also found in skunks. It's found in raccoons, it's found in foxes, so a few different animals, but most commonly bats.
What kind of damage does rabies cause to the brain and spinal cord?
Yeah, I mean, these are disturbing images. Listen, this is what's called a neurotropic virus, and that means that the virus tends to go for nerve cells. That's just what it does. That's where it lives, and that's where it causes its damage. So you'll get the bite. You'll get the virus from the saliva of the animal where it's carried. It tends to kind of just replicate locally in the muscle where the bite occurs, and then it enters into the nerve cells that feed that muscle, and it works its way up those nerve cells towards the central nervous system, and eventually up the spinal cord and to the brain. And you can imagine that as it damages those nerves along the way, it starts causing symptoms like numbness, tingling, spasm, sometimes paralysis. But it can affect very important muscles, the muscles that help us to breathe. If those go into spasm, then you can die from respiratory failure. It can cause spasm of the muscles that allow us to swallow, spasm of the airway up here, the larynx. And so any of those can be a cause of death, but eventually it can just get to the brain, damage the brain, cause a coma, and then eventually that could be the cause of death. So it's almost uniformly fatal by the time you have symptoms.
How crucial is treatment then after exposure, and what does that look like?
Yeah, I mean, because it's almost always fatal, you know, there are just a handful of people who have ever survived rabies. It's critical that you identify that there's a risk, and that's a starting point. And that's, you know, the sad thing in this story is that it wasn't identified. But there is a window of opportunity because the incubation time is long for this virus. It takes some time for the virus to take hold and cause that real infection. Typically, it's about 6 weeks. It can be a month, but it could be longer than 3 months. In some cases, it's been reported over a year. So there is that window of time where you can boost your immune system. And so the treatment there is actually to give the vaccine as soon as you know that there's been an exposure. And you unfortunately have to give 4 doses of the vaccine to boost that immune response. And we also give something called rabies immunoglobulin, which is basically like we did with COVID, where you get antibodies to the virus and you administer those antibodies directly. You collect them from people or from horses who have had exposure or had vaccination before and have antibodies. So you administer those and you just boost that immune response so that you can prevent the virus from taking hold at that time, you know, in that window of time after the exposure and before the real infection sets in.
The parents in this particular case said that they didn't see any signs of a bite. So I guess what is the degree of contact that one has to have with one of these animals to cause concern? Is it a bite or just contact?
You know, it's a great question, and there's been some debate about this. It really is, if you're awake, and that's very important because the child wasn't awake. If you're awake and alert and aware, and there's only been contact with intact skin, and there hasn't been a scratch or a bite, you're okay. What we're looking for is breaking of the skin by a scratch or a bite, or we're looking at exposure through open skin. You may have a pre-existing wound or a scratch, or you may have exposure on mucous membrane, so not protected intact skin. Any of those types of contact is a problem, but also unknown contact, and that's what this is. If you wake up and there's a bat in the room and you were asleep, it's unknown whether you might have had some type of contact where there might have been a break of the skin. And similarly, if the person has cognitive impairment, if they're not able to tell you, basically. And the challenge there is that the bats have these tiny teeth, and the bite can be really small. You may not feel it, and after you wake up, you may not see it or realize you have it, but the saliva has been transmitted. So any type of contact where it's known that there's been, basically a scratch or a bite, or a contact where, you wake up, for example, and you don't know, and you just have to assume that there's been some type of transmission and go forward from there.
Doctor, thanks for this.
Yeah, my pleasure.
Canada Tonight medical contributor, Dr. Samir Gupta.